For decades, spinal cord injury has been one of medicine's darkest dead ends. When the spinal cord is severely damaged, doctors can stabilize the bones, reduce inflammation, and save the patient's life, but they cannot restore movement. Once the neural connection is gone, it is gone forever. Or at least, that's what we believed, until a young man diagnosed with complete tetraplegia after a catastrophic car accident stood up and walked. This is not science fiction. This is not a miracle story. This is the result of a Brazilian scientific discovery that took more than 25 years to develop, and that may redefine what recovery means after spinal cord injury. What you are about to hear challenges one of the most deeply rooted assumptions in neuroscience, that the adult central nervous system cannot regenerate in a meaningful way. And it raises a question that makes many researchers uncomfortable. What if paralysis is not always permanent? Spinal cord injury is one of the most feared diagnoses in modern medicine, not because it is rare, but because it is final. A fracture at the cervical level can instantly disconnect the brain from the rest of the body, eliminating movement, sensation, and autonomy in a matter of seconds. Unlike broken bones, nerves in the central nervous system do not naturally regenerate. For decades, this limitation defined the ceiling of neurological recovery. Rehabilitation could optimize what remained, but it could not restore what was lost. That reality shaped how doctors spoke to patients, how families processed trauma, and how society understood disability. And then, quietly, inside a Brazilian laboratory, something unexpected began to take shape. Bruno was 23 years old when his life stopped abruptly. A car accident shattered his cervical spine, compressing his spinal cord at the C6 level, high enough to eliminate movement and sensation in all 4 limbs. When he woke up after emergency surgery, he could move only his head, no arms, no legs, no sensation below the neck. Clinically, this was classified as a complete spinal cord injury, the most severe category possible. For days, Bruno barely processed what had happened. The diagnosis came slowly, and with it, the realization that his future had been rewritten. At that point, the best-case scenario offered by medicine was survival with lifelong paralysis. Walking again was not even a conversation, but something unusual had already happened in the operating room. During Bruno's emergency surgery, a member of the medical team mentioned an experimental research project from the Federal University of Rio de Janeiro. A compound still under clinical investigation had shown promising results in restoring neural conduction after spinal cord injury. Bruno's family, including physicians, made a critical decision in real time. They consented to include him in the study. Within hours of the injury, during the same surgery meant to stabilize his spine, a substance was injected directly into the damaged segment of his spinal cord. Its name was polylaminin. At the time, no one knew what would happen next. Dr. Tatiana Sampaio did not set out to cure paralysis. Her journey began decades earlier, studying fundamental molecular interactions with no immediate clinical application in mind. She was investigating laminin, a naturally occurring protein present in the human body, particularly active during embryonic development. Laminin plays a crucial role in guiding neurons as the brain and spinal cord form in the womb, acting like a biological roadmap that allows axons to grow and connect correctly. While studying the molecular behavior of laminin, Dr. Sampaio discovered something unexpected. Under specific conditions, laminin molecules could self-assemble into complex, highly organized structures. This polymerized form, later named polylaminin, behaved differently from anything previously described in the literature. At the time, she had no background in spinal cord injury research. She did not know she was holding a potential key to neural regeneration, but science has a way of revealing its purpose slowly. As Dr. Sampaio explored the biological role of laminin more deeply, a realization emerged. During development, neurons grow by following laminin-based pathways. If adult neurons fail to regenerate after injury, perhaps it is not because they are incapable, but because the environment no longer supports growth. Polylaminin, when injected into damaged neural tissue, forms a conductive scaffold. It does not replace neurons. It does not act as a stem cell therapy. Instead, it recreates a microenvironment similar to the one present during early development, allowing damaged axons to reconnect and reestablish communication with the brain. In other words, the treatment does not force regeneration. It enables it. In Bruno's case, this process unfolded slowly, almost imperceptibly at first. Weeks after the surgery, a small movement appeared, the toe of one foot. Clinically, this was not trivial. Any voluntary movement below the level of a complete spinal cord injury suggests that neural signals are once again traveling through pathways that were believed to be permanently severed. From there, recovery progressed gradually. Partial muscle activation, increasing sensation, improved coordination. Months later, Bruno stood. Eventually, he walked. It is critical to emphasize what this discovery is and what it is not. Polylaminin is not a miracle cure. It does not guarantee recovery in every patient. Outcomes appear to depend on multiple factors: the speed of intervention after injury, the extent and type of spinal cord damage, and the biological context of each individual. In clinical trials conducted so far, not all patients recovered to the same degree, and some did not recover at all. Science rarely advances in absolutes. Yet, even with these limitations, the implications are profound. For the first time, there is credible human evidence that meaningful functional recovery after complete spinal cord injury may be biologically possible, not through external devices, electrical stimulation, or compensatory strategies, but through the restoration of neural conduction itself. This directly challenges one of the most entrenched doctrines in neuroscience, that the adult central nervous system is fundamentally incapable of regeneration. The broader impact extends beyond spinal cord injury. If the adult nervous system can be guided to reconnect under the right conditions, similar principles may eventually inform treatments for traumatic brain injury, stroke, and other neurodegenerative conditions, though these applications remain speculative and require extensive further research. Today, polylaminin is still undergoing regulatory evaluation. Larger clinical trials are needed. Many questions remain unanswered. But what has already been demonstrated is enough to shift the conversation. Paralysis, once considered an irreversible endpoint, may in some cases represent a biological state, one that can be modified. This story is not about a miracle. It is about patience, basic science, and the unexpected power of understanding how nature builds itself, and then learning how to recreate those conditions when healing fails. And it began quietly in a Brazilian laboratory.